Hi, and welcome to a brand new video today to which we are going to discuss about the procedure or the process on how do you extract an impacted maxillary third molar. Now, extracting this tooth is said to be difficult or almost all the time difficult because there is a limited visualization of the area and a limited access. Furthermore, factors includes reduced aperture of the mouth, and also the tooth is in a close proximity to the maxillary sinus. That's why it may make the surgical procedure a little bit difficult or more difficult than the other procedures, but with a proper knowledge on the process, the procedure on extracting a maxillary third molar, impacted one, and with you studying your case carefully, then you will have a success in extracting the impacted maxillary third molar. Now, before we proceed to the procedure itself, let us first classify the impacted maxillary third molar. Now, according to Archer 1975, the maxillary third molar may be classified according to its position. Now, it is classified into 7 types. For number 1, you can have a mesioangular, distoangular, vertical, horizontal, buccoangular, linguoalveolar, and the last one is inverted. Now, the tooth usually presents with a mesial or distal inclination with the occlusal surface positioned buccally. And the other type of classification for your maxillary impacted third molar is its depth. Impacted maxillary third molars may also be classified, that is according to Archer 1975 also, according to the depth of the impaction compared to the second molar. So it is classified into 3. For the class A, on the here, you can see here, Class A, the occlusal surface of the impacted tooth is at approximately the same level as the occlusal surface of the second molar. As you can see in the picture, the impacted one is the red one. So it's in a, the occlusal surface is at the same level of the adjacent second molar. And for the Class B is, here, let me show you the Class B. Class B is here, this one. Class B is the occlusal surface of the impacted tooth is at the middle of the crown of the adjacent second molar. So it's a little bit below the second molar at the middle portion of the crown. And for the third classification, the Class C, we have here 3. For the letter C, the occlusal surface of the crown of the impacted tooth is below the cervical line of the adjacent molar for letter C. For letter D, here, even deeper and contiguously or even above its root here, that one. Impacted teeth belonging to the third category are very difficult cases because their extraction entails the removal of large amount of bone, limited access, and the risk of displacing the impacted tooth into the maxillary sinus. So, if you encounter a patient with an impacted tooth that is categorized in Class C, it may be difficult to remove the tooth because you will need to remove large amount of bone, and again, as I said earlier, it is in a close proximity to the maxillary sinus. Now, let us also talk about the types of flap you are going to make in extracting a maxillary third molar impacted tooth. Now, we have 2 types of flap. The first one here, I can show you to the picture, this one. The first flap is called the triangular flap. The incision for creating the flap begins at the maxillary tuberosity, here on this one, maxillary tuberosity, and extends as far as the distal aspect of the second molar, continuing obliquely upwards and anteriorly or vertical incision to the vestibular fold. Now, in rare cases, as you can see here on the second picture, when impaction is deep and the satisfactory surgical field is necessary, or when the impacted tooth covers the roots of the second molar buccally, then the vertical incision may be made at the distal aspect of the first molar on this one, on the first molar. Now, the second flap that we are going to make, depending on the situation, we have the horizontal flap or the envelope flap. The horizontal flap, here I can show you the picture, this one. As you can see here on the first picture, the incision for creation of this flap also begins at the maxillary tuberosity on this one and extends as far as the distal aspect of the second molar, continuing buccally along the cervical lines of the last tooth teeth and ending at the mesial aspect of the first molar. And on this one, you can see here the flap being reflected. Okay, and that is it for the types of flap that you are going to make when extracting an impacted third molar tooth and maxillary third molar tooth. And for the removal of bone, here, in case you need to remove bone, often after reflection of the flap, part of the crown of the impacted tooth is visible, or there is bone protuberance over the crown. Because of the bone in this case is thin and spongy, it may be removed from the buccal surface using a sharp instrument. If the buccal bone is dense and thick, then its removal is achieved using a surgical burr. Now, to the procedure itself. So, this case that I'm going to present to you is the procedure for removing the impacted third molar is as follows. For this case only, okay? Now, this radiograph here showing a maxillary third molar with a distoangular impaction. And this one is the clinical photograph of the case shown in the radiograph. This one, as you can see here, there's the third molar there. Okay. Okay. And the surgical flap, or the type of flap that we are going to use on this type of, or on this case, on this particular case, is the triangular incision, the triangular flap. So this one here, oh no, I'm sorry. This one here, they're making a triangular incision. Now in the clinical photograph where the incision was made. Okay. And the next one is the mucoperiosteal flap is then reflected. Here, as you can see here on the picture, here is a diagram, and here in the clinical picture, the flap is then reflected and the buccal bone is then removed until the entire crown of the impacted tooth and part of its roots are exposed. Now, because the extraction of the tooth in segments is not indicated in this procedure, or in this case, in this particular case, sufficient space is then made and is created around its crown to be able to luxate the tooth here. So the next step is we are going to luxate the tooth. Thus, using a straight or double angled elevator in the mesial aspect of the tooth, always buccally, the tooth is luxated carefully, posteriorly, outwards, and downwards. Okay, so this picture shows the luxation of the teeth. As you can see here, they made enough space for you to luxate. And then, after the luxation, then you can safely remove the tooth, and care of the wound and suturing are performed in the same way as described for all other cases of impacted teeth. Namely, only if considered necessary, or for example, there are sharp bone edges, the alveolar margin is smoothed using Runger forceps or a bone file, and then the lingual and buccal plates are compressed using your finger pressure. This is done to restore the expansion of the socket caused by the extraction and also for initial control of hemorrhage. Hemostasis is also aided by the patient applying pressure and gauze placed over the socket for 30 to 45 minutes. And the last thing that you're going to do is to suture the area. And that is it for the extraction of an impacted third molar tooth, maxillary one. And I hope that you learned something, and I'll see you on the next one. Bye!